Amixin tablets is an antiviral immunostimulant, effective against various viral infections including influenza viruses, other acute respiratory viral infections, hepatitis viruses, and herpes viruses. After oral administration, the maximum production of interferon is determined in the sequence testing, liver, blood, after 4 to 24 hours. Indications: in adults, treatment and prevention of influenza, other acute respiratory viral infections, treatment of viral hepatitis A, B, and C, treatment of hepatic and cytomegalovirus infection. As part of the complex therapy of infectious allergic and viral encephalomyelitis, multiple sclerosis, leukoencephalitis, UV encephalitis, etc. As part of the complex therapy of urogenital and respiratory chlamydia, in the complex therapy of pulmonary tuberculosis, in children over 7 years old for the treatment of influenza and other acute respiratory viral infections. How to use? The drug is taken early after meal. In adults for non-specific prophylaxis of viral hepatitis A, the drug is prescribed at a dose of 125 mg once a week for 6 weeks, heading dose 750 mg 6 tablets. In the treatment of viral hepatitis A, the dose of the drug on the first day is 125 mg 2 times per day, then they switch to 125 mg after 48 hours. The course of treatment is 1.25 grams, 10 tablets. In the treatment of acute hepatitis B in the initial phase of treatment on the first and second day, the dose of the drug is 125 mg per day and then 125 mg after 48 hours. The course of treatment is 2 grams, 16 tablets. With a protected course of hepatitis B on the first day, the dose of the drug is 125 mg 2 times per day, then 125 mg after 48 hours. The course dose is 2.5 grams, 20 tablets. The chronic hepatitis B in the initial phase of treatment, the total dose is 2.5 grams, 20 tablets. In the first 2 days, the daily dose is 250 mg, then they switch to 125 mg after 48 hours. The course dose of Amixin varies from 3.75 to 5 grams. The duration of treatment is 3.5 to 6 months, depending on the results of biochemical, immunological, and morphological studies, reflecting the degree of the activity of the process. In acute hepatitis C on the first and second days of treatment, Amixin is prescribed at a dose of 125 mg per day, then 125 mg after 48 hours. The course dose is 2.5 grams, 20 tablets. In chronic hepatitis C in the initial phase of treatment, the total dose is 2.5 grams, 20 tablets. In the first 2 days, the drug is taken at a dose of 250 mg per day, then 125 mg after 48 hours. In the continuation phase of treatment, the total dose is 2.5 grams, 20 tablets, while the drug is prescribed at a dose of 125 mg per week. The course dose of Amixin is 5 grams, 40 tablets. The duration of treatment is 6 months, depending on the results of biochemical, immunological, and morphological studies, reflecting the degree of activity of the process. In the complex therapy of neuroviral infections, 125 to 150 mg per day in the first 2 days of treatment, then 125 mg after 48 hours. The dose is set individually. The duration of the course of treatment is 3 to 4 weeks. For the treatment of influenza and other acute respiratory viral infections in the first 2 days of illness, Amixin is prescribed at a dose of 125 mg per day, then 125 mg after 48 hours. The course dose is 0.75 grams, 6 tablets. For the prevention of influenza and SARS, Amixin is prescribed at a dose of 125 mg once a week for 6 weeks, heading dose 750 mg, 6 tablets. For the treatment of hepatic cytomegalovirus infection, the dose of the drug in the first 2 days is 125 mg, then 125 mg is taken every 48 hours. The course dose is 1.25 to 2.5 grams, 10 to 20 tablets. In urogenital and respiratory chlamydia, Amixin is prescribed at a dose of 125 mg per day for the first 2 days, then 125 mg every 48 hours. The course dose is 1.25 grams, 10 tablets. In the complex therapy of pulmonary tuberculosis in the first 2 days, the drug is prescribed at 250 mg per day, then at 125 mg after 48 hours. The course dose is 2.5 grams, 20 tablets. For children over 7 years of age with complicated forms of influenza or other acute respiratory viral infection, the drug is prescribed at a dose of 60 mg, 1 tablet, 1 time per day, after meals on the first, second, and fourth day from the start of treatment. Heading dose 0.18 grams, 3 tablets. With the development of complications of influenza and other acute respiratory viral infections, the drug is taken 60 mg 1 time per day on the first, second, fourth, sixth day from the start of treatment. Heading dose 0.24 grams, 4 tablets. Contraindications: children age up to 7 years, pregnancy, the period of lactation, breastfeeding, hypersensitivity to the drug. Side effects: from the digestive system, symptoms of dyspepsia are possible. Others: short-term chills are possible, allergic reactions. Amixin is compatible with antibiotics and conventional treatments for viral and bacterial infections.